We devote most of the program tonight to a look at the war on drugs with perspectives from the White House, the Congress, and a panel of experts. We start with President Reagan's speech today at the Coast Guard Academy, criticizing the Congress for playing politics with the issue and calling for new action to deal with the drug crisis.
I want to use this opportunity today to call for a special initiative. One of America's greatest strengths is our unique capacity for coming together during times of national emergency. We set aside those differences that divide us and unite as one people, one government, one nation. We've done this before, we must do it now. Illegal drug use is the foremost concern in our country. And frankly, as I finish my final year in office and look ahead, I worry that excessive drug politics might undermine effective drug policy. If America's anti-drug effort gets tripped up in partisanship, if we permit politics to determine policy, it'll mean a disaster for our future and that of our children. That's why today I'm calling on both houses of the Congress, both sides of the aisle, to join with my representatives in a special executive legislative task force to advance America's unified response to the problem of illegal drug use. Because if we cannot remove the politics from drugs, how can we hope to remove the drugs from our communities, workplaces, and schools? Our task force should agree on solutions for every area of the drug problem, from blocking supplies to curtailing demand, from treatment to education to prosecution, from interdiction and confiscation to eradication. Nothing should be overlooked or left out. Our policy is one of zero tolerance for illegal drugs, and we're looking for solutions, not just a restatement of the problem. And no later than 45 days from now, there should be a report to me and to the bipartisan leadership of Congress laying out our proposals. Let me take a minute to spell out some specific items that need to be considered. First, to deter violent crime and narcotics trafficking, we have to deal with the drug syndicates on our terms. That means when a death results from narcotics trafficking or when a law enforcement officer is killed in the battle, the law must provide for swift, certain, and just punishment, including capital punishment. I have also today directed Secretary of Defense Carlucci to tap the best minds both inside and outside of government to come up with creative solutions on how we can better use military resources and technologies to detect drugs and support civil law enforcement agencies in interdiction. We need stepped-up international eradication programs to reduce the supply of drugs and additional education and prevention programs to reduce demand, including the use of civil sanctions, such as fines and loss of federal privileges. Our encouragement, our goal should be for those who have never tried drugs to remain drug-free. You see, at the root of the drug crisis is a crisis of values and a spiritual hunger. I believe that as a society, we're still paying for the permissiveness of the 1960s and 1970s, when restrictions on personal behavior came under attack by a cultural establishment whose slogan was, "Just say yes."
President Reagan focused on drug issues in today's address in the wake of heavy Senate debate on the subject over the past week. Several drug-related amendments have been attached to a defense bill. A vote on the measure has been blocked by an argument over a proposal to impose the death penalty for certain drug-related killings. Congressional correspondent Cokie Roberts has a report on what's been going on in the Senate in reaction to the president's speech.
President Reagan took his message today to some of the men in uniform currently involved in the war on drugs. The response from congressional critics came quickly. Senator Alphonse D'Amato is a Republican from New York.
The problem of drugs is important, and it's unfortunate that the administration has not addressed itself prior to the election cycle to this problem. It's unfortunate that it took the Congress of the United States to drag them crying to the altar, so to speak, to perform the marriage of the military and a mission of at least detection, to help detect and to really use some of its resources of those planes and those ships that are carrying drugs in.
Senator D'Amato has been one of the leaders in the fight to involve the armed forces in the battle to keep narcotics from flowing over U.S. borders. He brought an amendment to the Senate floor last week to provide for surveillance and detection of drug runners and to use the armed forces' communications and intelligence.
And I'd suggest that we have achieved the proper balance here. And we may have to fine-tune this law, but why not use the technical resources, the radar systems, the detection devices that we have to help us track down those more than 20,000 planes carrying cargoes of death and destruction into our communities.
We have no prosecution, we have no lockups, we have no anything to follow this up except here we are in a great hysteria. Nobody is going to out anti-drug me, I can tell you that, and so we all get up, posture, make our little funny statements here, and it isn't going to make a hill of beans difference.
The plan to involve the military passed the Senate. The House of Representatives had already approved a measure to involve the military in the drug battle. The Senate then went on to add more drug-related amendments to the defense bill. Senator Jesse Helms' plan cut off all funds to the Panamanian military as long as General Manuel Noriega remains in power.
The bottom line, Mr. President, at least in the judgment of this senator, is that those obligations include the obligation to insist that the dictator, General Noriega, is brought to justice for drug trafficking aimed at the young people of this country and our present and future security as a nation.
And Republican leader Robert Dole's resolution called on the administration not to drop drug charges against Noriega.
The evidence appears to be overwhelming. Noriega deals drugs, protects drug traffickers, launders drug money. Pick your title, Noriega fits them all. Drug kingpin, drug overlord, drug godfather. Now, if we let Noriega off the hook on the drug indictments that have been brought against him, no matter what the motive, we have sent a very regrettable message to the world.
Senator D'Amato also wants to impose the death penalty for certain drug-related killings.
I'm pushing for the death penalty for those who order the assassination of people, the drug kingpins, who use that as a method to enforce terror, who would even assassinate police, who raise terror in communities, and we've seen it in one neighborhood after another throughout the length and breadth of this nation.
Others in the Senate agree with President Reagan that the whole issue has gotten caught in election 1988 politics. Washington Republican Daniel Evans is retiring this year.
It's the intensity of these political solutions that I think are in many cases leading us in the wrong direction. Using the armed forces unwisely, coming in with proposed death penalties for drug warlords when in fact the murders that are carried out are mostly murders of drug dealers. It's fooling the people, trying to make them believe that something is happening when in reality these efforts won't be very effectual.
A House-Senate Conference Committee will eventually decide the extent of the military's involvement in fighting the war on drugs, but the question is no longer whether the armed forces will play a role, but only how great that role will be. And it's clear that as November comes closer, the skirmishes on the drug issue in Congress and on the campaign trail will escalate, unless the voters decide that some other issue is more important than drugs in this election year.
In proposing his task force on narcotics, President Reagan said he planned to tap the best minds, both inside and outside government, to come up with creative solutions. And we have some of those best minds here tonight to consider some solutions. Dr. Mark Gold is Director of Research at Fair Oaks Hospital in New Jersey and founder of the National Cocaine Hotline. Sterling Johnson is Special Narcotics Prosecutor for New York City. Peter Reuter is a Senior Economist at the Rand Corporation. And joining us from Baltimore is Mayor Kurt Schmoke, a former Assistant U.S. Attorney and Prosecutor. You're a politician, Mayor Schmoke. Is that the problem now? Is it politics that's the problem?
Well, as you may know, I've recently made a speech to the U.S. Conference of Mayors where I called upon Congress to hold hearings to rethink the national drug policies. And I asked that these hearings be held after the November elections because I didn't want it to get involved in election year politics. Now, my proposal, as you may know, is that we should consider the decriminalization of drugs as one way of taking the profits out of these drugs and really going after the drug dealers.
I was going to come back to that a little later.
Well, the only reason why I mention it is that the president today said nothing should be overlooked or left out in our consideration of a new drug policy, and I want to make sure that that is an issue that's considered.
I see. Let me go around the table here and ask each of you, starting with you, Mr. Gold, how would you characterize Doctor, I beg your pardon. How would you characterize the state of the drug war and the response of the Congress and the administration so far, right now?
Well, I'd say that there has been some progress, but the progress has been difficult for all of us to see. The progress is difficult for me to see treating people who are drug victims, patients who are addicted, people who call asking for help. But there has been significant progress, and let me give you some examples. The progress that's measurable is progress in attitudes of high school seniors. It's very clear in following high school senior surveys since 1978 and before that perceived dangerousness. Do you believe that smoking marijuana occasionally is dangerous? Yes, over 3 times as many high school seniors. Do you believe that using cocaine once is extremely dangerous? Over half of the high school seniors now. You know, are you smoking marijuana every day? Rather than 1 out of 10 high school seniors, way, way down. Now, so there's been changes in attitudes. Now, all of us that are working on another front, AIDS prevention, talk about changing attitudes. You need to change attitudes. So we've had some significant change in attitudes. People don't say, I got addicted to cocaine, it's impossible, it couldn't have happened, cocaine is safe. They say now, cocaine is dangerous, I know I'm taking a risk or I'm addicted. So attitudes have changed, and I think, you know, a lot of things have come together. The media, Mrs. Reagan's efforts, the parents' movements, the Partnership for Drug-Free America, public service announcements have gotten people to the point that you can't find anyone, really, who says cocaine is safe or that drugs are safe. They're not as chic as they used to be. It's a far cry from, we were talking, you know, the kind of debates that I was in, 1975, 1980, even with 1983, with health professionals who said cocaine isn't dangerous, it's people that give it a bad name.
Let me ask Mr. Johnson, do you see, as a prosecutor, do you see some progress?
No, I really don't. In fact, I see we're falling back. We see conversations now about legalizing or decriminalizing drugs, which I think is extremely dangerous at a time
out of frustration.
It's a frustration. I really do think so. I can imagine someone being ill and you're having a doctor who's going to operate on you and he is under the influence of drugs. An airline pilot who's flying a plane and he's under the influence of drug. Babies that are born addicted, and you're going to give these young kids and you want to talk about that, there is really nothing to talk about. We have not had a war on drugs. We have not even had a police action on drugs.
There's no war on drugs?
We have not had a war on drugs. We had a lot of rhetoric, but no war on drugs. We've had 8 years of an administration that talked about it. We just had a White House conference, and now we want another conference on drugs. I think the best thing that happened in this administration is Mrs. Reagan. I think she's been terrific. And I say this as far as this administration, even the Democratic administration. We have not had a serious war on drugs since 1972 when President Nixon was there, and he was the man. We talked a lot. Now, I'm a prosecutor, a local prosecutor. We don't get enough resources to prosecute the cases. And we do a good job, not because of the administration, but in spite of the administration. And I have been here the night of the long knives when federal law enforcement did not have enough money to go out in the streets and buy drugs. And they're talking about a war on drugs. I think it's a farce. 1981, there were 50 tons, estimated 50 tons of cocaine coming into this country. 1987, you're talking about 180 tons. Now, we're winning the war on drugs. The next question is, who is we?
Do you see any discernible progress, Peter Reuter?
Well, there's certainly changes in sort of what you call the outputs of the criminal justice effort against drugs. I mean, I've studied it in the District of Columbia in particular. There you see a dramatic increase in the number of drug dealers that go to prison, for some period of time. I think the District of Columbia judges handed out 8,000 years of prison time, 30 times as much as they did in 1981. Yet we see lots of indicators going in the wrong direction. The number of deaths associated with cocaine use, emergency room admissions involving cocaine use, there's no question that all of these are up. I don't think that one can claim that there has been, with respect to current users, a change in the right direction, even though, as Dr. Gold said, there clearly are changes in youthful attitudes that in the long run suggest that things will get better, but it could be a long time.
Mayor Schmoke, is your resort to suggesting a debate on legalizing these illicit drugs, is it, as Mr. Johnson suggests, just out of frustration because you don't see any progress?
No, absolutely not. I am making this suggestion because I have been a prosecutor for 7.5 years, and I know that what I'm saying now is bringing common sense to this debate. It's not a retreat. It's fighting drug dealers on the turf that they really understand, and that's money. We cannot prosecute our way out of this problem. I live in a city in which we have a jail designed to hold 2,100 people. It has 2,650 in there. Our state prison was designed to hold 9,500 people. It's got 14,000 in there now. Well, and we can just keep prosecuting. Only thing I'm saying is that we have an example in Prohibition. And it was not prosecutors, it was not federal agents that ended the crime associated with the trade in alcohol. It was ending Prohibition. And what I'm trying to say is that I would like to end this latest prohibition and use these billions of dollars of resources to attack this as a public health problem. And if you don't agree, at least let us debate it during the course of these hearings.
We did debate that on this program about 10 days ago, and we don't want to go into it in detail, but I'd just like to hear what each of our guests tonight has to say about, since we're not excluding any possibilities, about the legalization issue, and then we'll move on to some of the other things that are being discussed. What do you think, Dr. Gold?
Well, first of all, when we talk about alcohol, we talk about a drug that's widely available and that causes at least 8 and sometimes 10% of the population to need treatment at one time in their life. The estimates from professionals, just taking cocaine alone and saying, you know, what percent of the people who've ever tried cocaine, if cocaine were legal, would require treatment resources. That would cost a lot of money and cost a lot of lives. To talk about emergency room visits and hospital treatment, we don't have a treatment for cocaine overdose. That's the reason that people are dying. In addition to the fact that the drug kills, there's no treatment. You're better off to overdose on heroin. Anyway, the estimates from experts would be somewhere in excess of 1 out of 4. Some experts say 1 out of 3 people who've ever tried cocaine, as compared to the 8% that we're stuck with of tragedies and misery with alcohol. We have, you know, as Mr. Johnson said, the whole issue of cocaine-intoxicated babies. We're dealing, everyone's frustrated because doctors are trying to help people. We have no treatments for overdose. If you look to medical treatments as the cure, I'll tell you, we have good treatments for heroin overdose, we have good treatments for heroin detoxification, and we have a new medicine that prevents people from ever feeling heroin again or preventing relapse. Those treatments didn't solve the heroin problem. You can't look at research and research treatments and say those medical treatments are going to solve the problem. Not at all.
That's your argument against it. You've made yours, Mr. Johnson.
But there's also, you'll have an example in England. They've tried that, a dismal failure. And I've had people come over from England to speak to me about what can we do because our free heroin experiment did not work. Just not going to work.
What do you think, Mr. Reuter?
Well, I think the reference to the English experience is somewhat misleading. The English tried a medical model in which you could, as an addict, obtain heroin from a clinic, but the clinics were in the hands of doctors. Doctors are in the business of curing people, and they stopped giving out much heroin and started moving their patients towards methadone and a lot of talking. And that, I think, was part of the reason that the experiment, or the policy seems to have failed and created a large black market. I think there are no analogies that really, analogous experiences that really give us clear direction about what would happen with
the prohibition analogy is not a good one.
No, because that was, I mean, whatever we think about the seriousness of the cocaine problem, we're not talking about a drug that is really available to you know, throughout the length and breadth of this country to every segment of society. It's still expensive. It's still regular cocaine use is still a rare behavior. It's a very different business to regulate this market, even though it turns out to be expensive, than to regulate the alcohol market after it has become, as Dr.
Okay. Obviously, that's a very big subject, and I'm sure we'll be coming back to it as this debate that Mayor Schmoke and others have proposed goes on. But let's take, in the remainder of our time, some of the other ideas that are being discussed. You, Mr. Reuter, have just done a study for RAND on what the effects would be, or the effectiveness of using, as the Congress has now mandated, the military in an increased way for drug interdiction. Just briefly summarize your findings for us.
Increased military involvement, any increase in the interdiction effort, no matter what the resources used, is likely to have a very modest effect on the cocaine problem, on the drug problem in this country. There are simply too many ways of bringing drugs in, not all of them subject to the sort of use of military assets. Smugglers have proved too adaptable. There's too much refining and production capacity down there. There are too many smugglers now with experience for interdiction to really have any prospect of making a significant dent in cocaine consumption in this country.
So, do you agree with Senator Evans? We saw a moment ago said all this talk of using the military is just fooling the people. It's not going to do anything.
Well, that's a political interpretation. I think there's a certain amount of sincerity to the cause. There's sort of a natural instinct to reach for the high-tech military, but against the low-tech foe, I think Senator Evans is right. It will do very little.
Mayor Schmoke, what do you think about using the military in an increased way?
I think it'll just drive up the cost of drugs on the street, and it'll make the price higher. It'll mean more junkies have to break into more homes and steal more goods in order to deal with the price that it's going to...
It'll drive up the price, you believe, because it will be a little bit effective in shrinking the supply, you mean?
It will probably... We admit now as a government that we interdict about 10% of the drugs. If we interdict another 10%, then the cost of the 80% is just going to increase.
That's an argument you've made earlier on this program, Mr. Reuter, that any effective shrinking of supply only drives the price up and increases the motive for engaging in the trade.
Look, no, where I disagree with the mayor is that we can, in fact, affect the street price very much through interdiction. I mean, when cocaine lands in this country, it sells now for about $15,000 a kilo in Miami. The street price is something more like $250,000 a kilo. We can seize a lot of $15,000 a kilo cocaine before we make much difference to the street price. Interdiction can only affect drug consumption through price, but alas, it can't do much to affect that price. We can have a lot more interdiction and see very little change in consumption.
What do you think of using the military in an increased way, Mr. Johnson?
First of all, I think it's a given that the military will be used. They're going to go to the altar. It might be a shotgun wedding, but they're going to go to the altar. I think that Mayor Koch's suggestion...
New York Mayor Koch.
New York Mayor Koch's, just to take these people who must do 2 weeks active duty and put them out at the airport and let them do some searching and assisting the customs authorities. I think we have a resource, and we have to use every available resource that we have. If it works, fine. If it does not work, at least we have
no harm
tried.
Done,
no harm done at all. I also disagree with Mr. Schmoke, or Kurt Schmoke, in the sense that we have been seizing more drugs than ever before, and the price has not increased, the price has decreased.
Because the supply, presumably, despite the seizures, has increased.
Absolutely. We are doing one heck of a job. I mean, tremendous job.
But the smugglers are doing an even better job.
They're doing an even better. And there are more of them. They have more resources. In 1981, a kilo of cocaine would cost you $60,000 in New York. And as Peter Schmertz said, right now in New York, I am buying a kilo of cocaine for $15,000. You can get it $8,000 or $9,000 in Florida.
Just a moment. You talked for a moment about using military people to help the customs people. What percentage of the drug smuggling is done through being flown in by planes and brought in by ships, and what comes in the personal baggage of...
Drug smugglers are limited only by their imagination. They can bring it in using the cavities of the dead bodies of babies, and this has been done. They can same thing for the
but
soldiers.
what percentage comes in big lots in through the skies and through boats, and what comes in personal baggage?
I don't think we really know.
You don't know.
We just seize, or the Drug Enforcement Administration just seized 4 tons in Florida, and the next day, Drug Enforcement Administration here in New York seized another ton or a ton and a half, and there was no impact upon drugs on the streets of New York.
What do you think about the use of the military for interdiction?
Well, people in treatment want any measure that increases the price of the drug, because we see hundreds, and some people hear from hundreds of thousands of addicts who say, if it was just a little bit less expensive, I could use more, and I would be in the emergency room, and I would be hopelessly addicted. Part of what's happening.
So even if it were marginally effective, it would be
reduces
an assistance
the number of people who are in emergency rooms who die and who need treatment. In addition, we have like a very confusing situation. We hear the proposal for the military, but what we're doing is we're using the military to basically close off our borders, and no one is proposing using the military to attack the actual source of the drug. For example, we know where at least 70% of the cocaine is grown, on plants. We have probably the ability to identify this site, the valleys, and we probably could attack them, and it takes 2 years for the cocaine plant to mature. We could cause a 2-year problem. Now,
if you had the agreement of those countries to
exactly.
do it. Yeah.
So, there are creative ways that the military could be even more effective than just sealing off the border. Let me propose one more thing that we see. We see the cocaine epidemic, and as you know, we've been tracking this since it started. Changes all the time. It started as the drug for the rich and famous, the employed. Now, the typical cocaine user tends to be uneducated, without a job, early 20s, poor, living in a city. A lot of cocaine is coming in. The interdiction is picking up more and more of the drug, and the price is going down. One possible reason might be that the price is chasing the continuous users, the poorer users who can't afford the exaggerated price, and much of cocaine is being wholesaled in the United States, transshipped to Europe.
We have just a few minutes left, and I'd like to come back to the other proposal that's attracting a lot of attention, and in fact holding up a Pentagon bill in the Senate now. Would it do any good to mandate the death penalty for certain crimes committed by drug users? Would that make any difference?
It would make a difference to the person who's been executed. Now, you're asking a ex-police officer. I worked with the Drug Enforcement Administration, and I am aware of those situations where they have tortured agents and murdered and assassinated police officers, and I think, yes, there should be a death penalty for people who do this.
I won't disagree. Our problems are more pervasive than that. For years, we've known that cigarette smoking is dangerous. The packs have labels. There's no question that people knew this. That didn't change their behavior. What's changing cigarette smokers' behavior are these rules that are isolating them and separating them and causing you and I and other people to say, you're abnormal, you're sick, there's something wrong, stop, get away from me, don't blow smoke at me. But let me tell you that right now, people aren't looking at themselves. They go to parties where people use drugs and they stand by. They walk past it in the street. We have very basic problems and tolerance for drug users.
You mean people who would not tolerate somebody smoking a cigarette beside them will go to a party and tolerate somebody smoking pot or taking coke or something?
No question about it. Right. And I see this. I confront this. I've confronted it myself as an expert at a concert where I said, these are non-smoking seats. What are you telling me? And they said, well, that's only cigarettes, doctor.
Do you have an opinion, Mayor Schmoke, on the mandating the death penalty for some drug-related crimes? Will that do any good, or is that just political rhetoric?
It's just political rhetoric. I think that what you've seen tonight is that we cannot all agree on the same strategies, and there's differences of opinions about what will be effective. I hope that we can agree, though, that there is a need for the country to rethink its policies, to do so in a very thorough way after the 1988 elections, and try to come to a new consensus.
We have a minute or so left here. Briefly, what is the one thing each of you would like to see done, and I emphasize briefly, that would really be a creative and helpful thing? Mr. Reuter, do you have an idea?
I'm better at figuring out what doesn't work than at thinking of things that will. I think that if we are going to keep the prohibitions, that using more of our resources against users rather than against dealers has some attraction. I wouldn't sell it as the answer.
Okay. What is your idea?
You have to have a commitment from 1600 Pennsylvania Avenue, and not just a rhetorical commitment. Drug abuse has to be on the same...
commitments means big money, does it?
Whether big money or the best minds, but it has to be on the same plane as the defense budget, the economy, and even communism. But we haven't had that since 1972.
What is your idea?
I would agree with Mr. Yoder on that idea and say, in addition, when we turn to doctors, don't expect treatment to be the answer, that we have good treatments for other drugs, and that's not the answer. But please, let's devote some resources to get a treatment for these people who overdose from cocaine. Len Bias, if they would have been able to give them the same thing we could give a heroin addict, would have woken up and said, oh my God, I'm going to go to Cocaine Anonymous meetings.
Mayor Schmoke, besides legalizing or debating legalizing, what is your idea?
Essentially, my idea is to treat the drug problem as a public health problem and not as a crime problem. Let's use these billions of resources to go after it as a health problem.
We thank you very much for joining us, Mr. Reuter in Washington, Mr. Johnson, Dr. Gold in New York. Thank you.